Dufele Center 3 and Laropiel Center 3. We have registered a very good positive response and successes in our project implementation. We have seen a lot of improvement in family planning take-up, but also we thought it wise that as we give services to the community, how best can we improve it in case maybe there are gaps, and also how best can we support the facility and the district as well in terms of sustainability and also other areas which are of interest. And that is where now we came up with this initiative of having some kind of incentive-based project where a facility where we do partner with them, they offer the service to the clients, but also out of the services that they offer to the clients, there's some small percentage of the token that we give back to them, like sort of appreciation. And that is why we are here today. Out of the effort that they have put in, we managed to get some few equipments which are there in front of you, that I would request you will at appropriate time come and verify them. Among these things that we have received, we have the cupboards, like the drug cupboards for storing drugs, especially in the dispensing room. We also have the bed screen. We have examination beds. Of course, other things are still inside. These are just few samples which are outside. These things we didn't just come out of. It didn't just come out of our mind, and we said the facility needs some of the things. After a period of time, like maybe 6 to 8 months, we normally see what the facility has reported to us, and we compute it in terms of money. So when we compute it, we go back to them and ask them, what do you feel you would do? What do you feel you have? Where do you feel you have gaps? So that we can see how best we can support the facility. And this is what they come up with. From here, now we go ahead to purchase them, procure them, and now deliver them. But before we always deliver, we always want it to go through the normal process of the district acknowledging them, and before we can take it to the facility.
One RDC, the biggest challenge we are facing as a district is related to the young person, the adolescents, but also our newborns. As we talk now, our recent data shows that per 1,000 live births we have in the district, at least 9 of these babies die. There are so many reasons why this is so, and our biggest challenge as we talk now is babies failing to breathe immediately after birth. And one of the reasons is that there is the delay in accessing care by our mothers, and that makes the baby tired in the womb. Secondly, related to the adolescents is the issue of drug, substance abuse, and misinformation. When I came here, I saw DSTV, and we think this can contribute a long way of relaying messages that are tailored to the young people when they come for services at the facility. I want to thank the RDC and the district chair for the leadership, for the enabling environment you provide to our partners. This is an example of a very good friend to the district, and so we want to thank you so much. As a government, we provide the leadership at different fronts, but also the services, but occasionally we run out of commodities and equipments, and so what you're going to give us today, though few and to limited facilities, can contribute a lot to improving the quality of care for the target population.
All supplies that you provide for us in the district here is on behalf of government. So I want to thank you so much for adhering and also for supporting the government in achieving its mandate, especially on the health sector. So I don't want to talk much. I think we have witnessed some few items outside here, and we still have more in the store. So our work as a district and as a political offices is to make sure that all whatever has been given or brought in by our IPs are put in right use. So as a Secretary for Health, when these items are delivered, I'll also try to put my eyes on them. I'll make sure that these items that are delivered to these health facilities are put into right use. And also I'd like to implore you to keep on lobbying, also keep on identifying other gaps. Apart from what you have brought today, there might be other critical needs of these facilities which are not yet, been handled. Sure, I'd like to implore you. I also want to pray that God gives you more wisdom to continue lobbying to your donors so that our facilities continue to get these supports. And I also pray that in your next project plan, you should also plan to add in more health facilities where you can take your as projects in, because in more districts we do not have only 3 health facilities. We have many that also needs this kind of services. So I want to pray that in your next coming plan, you will also have maybe some few health facilities added on these 3 that you are working in. So I want to say thank
and His Excellency Yoweri Kaguta Museveni for coming up with a very conducive health policies for the people of Uganda, which has paved the way for our partners like Akotev to come on board. Akotev, you are one of our reliable partners we have ever seen in the district. We thank you so much of all the efforts you have put on board to bridge that gap where government may not all deliver so that we get service for our people. Despite all these global challenges, you are able to bring us good number of items which are very critical in health service delivery in these health centers for the adolescents and the children, which we actually are focusing on to put their life in this world. My humble advice to all of us, yes, we have seen this equipment, we need the in charges in these various health centers to take full charge of these equipments. Let's avoid the tendencies where equipments are being swindled from the health center. Let's take care of all what we have received to ensure the actual work is done for our people in the health sectors. As Office of the President, we shall keep working with you, the partners, to ensure we provide security, peace, and all necessary you deserve in order for you to deliver service for our people. We thank you. We shall be working in collaboration and coordination to give equitable health service for our people in the district. With these few remarks, I want to thank all of you